Darshan Shah, he is the founder of Beautologie Cosmetic Surgery and Laser Center, and he's here to talk about the dangers of plastic surgery. He has a new book out called Making the Cut, 10 Things to Consider Before Going Under the Knife. Good morning, Dr. Shah. Thanks so much for coming in.
Thanks for having me.
And you kind of presented this as an interesting thing. You know, obviously you do plastic surgery, but you're telling people when they shouldn't do plastic surgery because there are a lot of reasons to consider before you make that decision. It's a big medical decision.
It's a huge decision. I think people, because it's on the TV all the time, because there are so many shows about it, celebrities are doing it constantly, people have this misconception that it's just as easy as going in for like maybe a haircut or a facial or something, but it's actually a real surgical procedure. You're under anesthesia. There are real risks involved, and people need to take it just as seriously as though they were going in for a real operation.
That's very true. Yeah. It may be called plastic surgery, but you're talking about your body here.
Exactly.
So you want to be careful. So what is the #1 reason, we can't get to all 10,
right,
the #1 reason you should not do plastic surgery?
I think the first thing that you have to consider is making sure you're healthy enough. And a lot of people are unhealthy for various numbers of reasons. Either they're smoking, or maybe they're a little bit overweight, or they have other health problems like high blood pressure, diabetes. Those are all things that we need to consider. Remember, plastic surgery is elective. It means that you can do it whenever you can fit into your life at the most appropriate time. So why not be as healthy as you possibly can be before you undergo plastic surgery? I always tell my patients that plastic surgery should be a part of your transformation, not just the transformation. And it's a part that comes more towards the end than the beginning.
Yeah. Well, and what are the dangers if you are not healthy enough of doing plastic surgery?
So for example, the more overweight you are, if you have diabetes, high blood pressure, you can have healing problems, you can have more infections, you can have prolonged operative recovery, you can have more anesthesia complications. These are all serious complications. And so the healthier you are, and it's up to the doctor and the patient to both have an honest conversation about this. And we always ask patients to also talk to their primary care doctor who knows their current health status better than anybody.
And let's talk about what's your second biggest reason people should not do plastic surgery?
Smoking is a huge reason. You know, there's still, I can't believe it, but there's still so many people that smoke out there. And even one cigarette reduces the blood supply to your skin. Your skin is the biggest organ in your body, but has the tiniest little blood vessels. And those tiny blood vessels get clamped off when you're smoking. So we always insist that everyone stop smoking before surgery for at least a month.
Okay. And then third, this morning you wanted to talk about?
Oh, so another reason that I think is really, really important is making sure you have realistic expectations. I think people look at pictures they see on the internet or TV or in magazines, and they assume that a plastic surgeon can turn one type of body type into a completely different type of body type. And it's absolutely not true. I think having realistic expectations is key, and the way you do that is to have a long and open conversation with the doctor and look at pictures of people that look like you before and what their afters turned out like. And that gives you a more realistic view of what to expect.
Yeah, you don't want to go through this huge, expensive and dangerous, or risky, we should say at least, procedure and then not be happy on the other end and feel like it wasn't worth it.
Exactly, exactly. When I wrote this book, the publishers didn't like my original name, which is 10 Reasons You Shouldn't Have Plastic Surgery, and they made me change it. But really, there are more reasons you shouldn't do it than you should do it. And of course, once you go through the book, and we have a test at the end of every chapter, if you take all the tests and you pass them all, then it's probably an okay idea for you to do it. But I think there's a lot of things to consider before you go under the knife.
I thought another thing that was interesting that you said is actually in the book also is the addiction that can arise to plastic surgery.
Oh, absolutely. And I think it's up to people themselves to look at themselves and really think about why they're doing these procedures. Is it because they just love doing it and they love the compliments and things they get afterwards, and then they're getting addicted to that positive feedback? Sometimes going under the knife multiple times can also lead to complications and dissatisfaction. And, you know, the perfect example of that, unfortunately, is someone like Michael Jackson, who operated on his nose multiple times when he should have never done that. And multiple cosmetic surgeries are also a risk factor. So you have to notice when you're doing that.
And talking about that one and the unrealistic expectation reason as well. Do you think that sometimes it's important to have like maybe a mental evaluation or talk with a therapist before you go forward with something like this if perhaps you're doing it for the wrong reasons?
Absolutely. In fact, there's a whole chapter in the book dedicated to that and a self-assessment of your mental state before you do plastic surgery. So if you're really thinking that you might be doing it for the wrong reasons, maybe you're addicted, maybe you're doing it to keep yourself in a relationship, maybe you're doing it because you just got out of a divorce, it's definitely good to seek out counseling before you go see a surgeon.
Again, a very serious thing that you should consider before you ever take that step. But it's called Making the Cut, and by Dr. Darshan Shah here with Beautologie. And we thank you so much for coming in this morning and talking about this. It is funny to think of a plastic surgeon talking about why you shouldn't get it, but it is a very important topic of conversation.
Yes.
All right, thank you very much,
so much
sir.
for having me. I really appreciate it.
Our pleasure. Well,